So Ben, I'd love to just jump in for a second and ask John a question about CMS. I know kind of historically with the High Tech Act, there was a lot of investment to help get HIEs launched. And then obviously that was years ago, and we're seeing this evolution now. You're talking to us about it. How do you envision HDUs contributing to the work that CMS does?
Sure. I think we're learning that every agency has specific health data needs, and they've been trying for their histories to fulfill those health data needs through different approaches. We've seen many of those approaches in recent years, and there's been an evolution. Most recently, I think the dialogue, you asked specifically about CMS. We could talk about any of the agencies, but CMS is an extremely important one. I think the shift is in the federal agencies entertaining the idea that state-based infrastructure could be a key building block in meeting their health data needs. In the case of CMS, that could be electronic clinical quality measures, for example. But I think really the shift is that you remember we're talking to an HIE guy here, so I have that bias. But over the last several administrations, regardless of political party, it's HIT tends to be a bipartisan issue. Is there a lot of the policy has been based on trying to harness individual EHR instances and standards. And those are both very important things. But I think as a country, we've been missing the opportunity to leverage state-based infrastructure like HIEs, health data utilities, whatever they call themselves. That state-based infrastructure can be valuable in meeting the needs of federal agencies like CMS.
One kind of just a quick thought there, if it's done well, it certainly reduces the kind of the federal costs and overhead, while also enabling kind of more local or state or regional ability to, I guess I'd say, innovate, and also to pay attention to what matters on the ground, and not be constrained as much, as long as they're still meeting, of course, the federal requirements, but not be constrained as much by what the federal government's willing to invest in, right? I think that's one of the powers of this potentially.
Absolutely. And I've spent some time trying to imagine what it's like working for a federal agency, and you have to kind of wake up every morning and thinking about 50 states and 6 territories. And there's a desire to want to have a homogeneous solution that works for all 50 states and 6 territories. But healthcare information technology and health data interoperability is a complex issue, and that's, I think, simplistic thinking. I think we need to be able to accommodate some heterogeneity, meaning that letting states be states and letting them build that state-based infrastructure however it's able to evolve in their state. But then the federal government saying, okay, here's what I need. I really don't care how you get it to me, Indiana, Colorado, Kentucky, whatever the state is. So that's, I think, the potential power of leveraging the state-based health data utilities.
I 100% agree. And I really am looking forward to seeing how, I think, I've seen indications that this administration wants to move more towards kind of an outcomes-based approach, and focus less on the infrastructure itself, but more on saying, as long as the infrastructure delivers these things, which I think gets to, and we'll talk about that, the capability model and how that can support that.